And we are back, Boozlers. And thank you so much for staying with us. Just before the break, we had a dynamic, exciting conversation about political voices in Belize, a new book that's going to be launched on Thursday at the House of Culture at 7 p.m. Correct me if I'm wrong. 6 p.m. You see, 6 p.m. Make sure we get the date and the time correct. Come out and get your copy. It's $100. We're taking cash only, babe. Come out and have a great time. But we're moving into our next exciting, very important, and timely conversation with Dr. Rachel A. Corridon. That is an OBGYN, and we have her via Zoom. And she's from Trinidad, so we're really excited to be getting our Caribbean brothers and sisters in the conversation as always. So, Dr. Rachel, talk to us. How are you doing this morning?
Hi, Belize. I am doing very well, and thank you so much for having me on the program. I'm excited to chat with you guys as well as a fellow Caribbean sister.
Yes! And then,
folks in Trinidad.
Yeah, all the Trinidad people, big up to you guys. Which part of Trinity are you from? Kevin's checking out, just to see.
I am from the east, very near to the airport.
Okay, nice. Well, over here in Belize, we're having a very chilly time, so we're hoping that the Caribbean warmness comes from your vibe and you warm us up too. But this is a great conversation, and thank you so much for creating the space and being able to, engage with us on cervical cancer. We understand that January, as we're just coming off, that was a cervical cancer awareness month, and it's really important to keep these conversations alive, and it's very timely for persons to take care of themselves. On the note of cervical cancer, what would you say, as a doctor, has been one of the things or the big myths, before we even get into things too deep, that people often think when they think about cervical cancer, the thing that you have to say, that's not really how it goes, that's not how it is, etc., etc.?
Well, the first thing is, it can never happen to me. That's the first thing. And if there's no problem, I don't need to get checked. Everything is fine. So no news is good news. In the Caribbean, we don't like to go to the doctor. We wait until the last minute. We don't want to be checked. If nothing is happening outwardly, then I don't need to have a check. And so just like with breast cancer and the need for breast screening, that lack of education and that lack of drive for women to get themselves checked, I think that is one of the main issues that we deal with when trying to get a handle on cervical cancer and cervical cancer prevention.
That is true. I hear that, very common, where people are afraid of going to the doctor because they have the fear of what the result may be.
So I'm not go.
Right.
If I don't know, if I don't go and I know,
exactly,
it not hurt.
Yeah, but one thing we've understood, from being healthy and being able to maintain your well-being, and now we're drawing it to cervical cancer, is that prevention, like doing your screening, is very important in prevention, but also in being able to access early treatment. Are we right with making that statement, Dr. Rachel?
Yes, you are very, very correct. With cervical cancer specifically, it's one of the cancers that we can actually prevent, and we wish we can eradicate. Simply because cervical cancer is not something, unless it's an unusual, aggressive type, it's not something that happens yesterday and you see it today. It's something that happens over time with abnormal changes on the cells of the neck of the womb, which we call the cervix.
Yeah.
And if we are able to find these changes early, detection, we are able to act before we have the change fully over into an invasive cancer. And by that, we can save so many lives, just as you said, by early detection.
Very good. So let's talk about, the screening process, because we really want people to, be more proactive with their, looking after their health. How often should someone go for a screening? What are the recommendations in terms of age, in terms of, I know there's certain processes in terms of certain days during your menstrual cycle, all of these things. What is the guide that you have to provide to persons as in regards to screening for cervical cancer?
Well, screening for cervical cancer is very geographic or location specific.
Okay.
So the ages can vary slightly based on where you are coming from. I did a little research, and I think Belize, they start at 21, similar to the US. In the UK, they start at 25. But generally, between the ages of 21 to 65, a woman should be having her routine pap smear.
Okay.
And we want to do this every 3 years.
Every 3
And if
years.
we add something called HPV testing, which we can speak about HPV as we go along in the conversation, but if we add human papillomavirus testing to your cervical cancer pap test or your cervical pap test, we are able to actually stretch that cervical screening out to every 5 years once you have a negative HPV test. With respect to when you want to do your screening, you want to do it typically at the end of your cycle when you're no longer bleeding.
Okay.
Because bleeding or having red blood cells in the sample can sometimes obscure the test.
Okay.
And so we also want to encourage you not to have unprotected intercourse right before your test because we can see the sperm, it can overshadow some of our cells, and that could be in the sample as well. So these are some of the things we want you to think about when getting your smear done. We want you to know that you have to do it between the ages of, let's say, 21 to 65. And after the age of 65, once you've had normal smears, I usually would tell my patients, you have graduated, here's your hat. You are no longer in the system.
Very good.
Oh, wow.
That was super helpful. Thank you so much for giving that guide to persons that are, thinking about going to get their pups.
I want to ask, because I know you mentioned HPV now. Do you recommend, or what is your outlook on having persons get tested for HPV and then you get your pap smear? Or is there like a thing where you'd really recommend that has to be done before, or in that aspect?
Or in combination.
Or combination, thanks, Kev. Like, I'm wondering in that aspect, because people don't necessarily look at HPV. They're just thinking about doing my screening, but how necessary do you think it is to also get the testing for the HPV before, together, afterwards? What is that looking like?
That is an excellent question. Now, again, it all depends on your jurisdiction. In the UK, for instance, they have started primary HPV screening. Okay. So that means you can do just the HPV test, and once it is negative, you go on to every 5 years testing, just primary screening. In other jurisdictions, you can do your pap test alone. And in other jurisdictions, they encourage the core test. That's where you do both the pap smear and you add HPV testing to that current pap smear sample. Additionally, we can do reflex HPV testing. For instance, if we get back a pap smear result that has a low-grade abnormality, we can then do an HPV test to place that patient into a risk category. If the HPV test is negative, we can reassure the patient and put her back into the screening system schedule. But if the HPV test is positive, we can now direct the patient to further testing, for instance, colposcopy and biopsy. So we can use the HPV test in different ways. We can use it for primary screening in place of a pap smear. We can do it with the pap smear, or we can use it as a reflex test to categorize our patients in terms of risk so that we can reassure or send forward for further testing.
Very well. Thank you so much for that. Dr. Rachel, I would like to get your perspective on this. In Belize, we do have HPV vaccines available. How would you recommend the use of HPV vaccines in terms of prevention? Is it something that you advocate for?
Definitely. The WHO, as one of its mandates with respect to cervical cancer and trying to eradicate cervical cancer, they are actually trying to get 90% of our girls, they're focusing on girls, but girls and boys can be vaccinated. They want to get 90% of our girls vaccinated by the age of 15. Why do we want to vaccinate early?
Yeah.
We want to catch the adolescents before they have started having sexual activity. And the reason is HPV is actually one of the most common, commonly transmitted sexual infections. So if we can vaccinate before you come in contact with the virus, we are able to prevent not only cervical cancer, but we have to remember that it also involves the anus, head and neck cancers, like the throat, the tongue. We can also prevent non-cancerous lesions such as genital warts, which could be very, very traumatic for someone when it happens to them.
Yeah.
So HPV vaccination is something that is very important. If we are able to educate and encourage our parents to bring our adolescents to the clinics, get them vaccinated, make the vaccines available. If we are able to, in Trinidad and Tobago, for instance, the HPV vaccine is available for free in our local healthcare system. If we are able to do things like that, improve access, improve education, improve understanding so that we can improve and increase uptake, then we are able to do better with reducing our cervical cancer and other cancers with respect to HPV.
Very good. Thank you so much for that information. I'm sure that people are able to connect and understand better the importance or the value of getting an HPV vaccine, especially to our young adolescents, in terms of prevention of HPV, which, from what I've gathered, is an agent for cancer to develop, because you mentioned like anus and throat and tongue and all of these things. Dr. Rachel, as I start winding down this conversation, I want to ask you about the treatment for HPV. Is there like any new treatment that you've heard of that makes people more hopeful in terms of like if they were ever diagnosed with cervical cancer, like my chances of getting cured is high, right? So like what kind of like treatments is available for HPV? I mean for cervical cancer, and what is the success rate for the treatment?
What we know is that if you are detected and treated early, your chances of survival exceed 80 to 90%.
Okay.
That is what is important. So what is important is stressing, again, screening and early detection. Once we have noted either HPV present in a pap smear sample or we have a high-grade abnormality in the cells, we then forward that woman towards colposcopy and biopsy.
Okay.
With these biopsies, we are sometimes able to actually treat by removing a significant portion of the inner cervix that is housing the abnormal cells. And when we remove, we call it a wedge of tissue, when we remove that tissue and we send it to the lab, the laboratory is able to explain to us or tell us if the margins are clear of disease. And it's very reassuring when the margins are clear, because then we can say that is actually curative. And in fact, we also know that for some women, as we discuss on a case-by-case basis, even after having an abnormal pap smear and going through treatment, we can actually consider HPV vaccination, even in that woman, on a case-by-case basis. The reason is there are many serotypes of HPV that can cause both high-risk lesions, which would be cancers, and the low-risk lesions, which would be like your warts. So there may be still room and a place for HPV vaccination, even in a woman who has had an abnormal pap and had treatment. With respect to treatment for cervical cancer, that is a wide range in terms of the discussion. And that discussion doesn't only include the general gynecologist, but it also includes the gynae-oncologist. That is a subspecialty in gynecology. We have the medical oncologist, that's the person that is going to be issuing probably your chemo. You have also the radiation oncologist, that's the person that's going to be guiding your radiation therapy if it is required. We also have other specialties, such as your radiologist, who is going to tell you how advanced and try to stage before surgery, and also your pathologist. So it's a very wide-ranging conversation that we have when we are now discussing and trying to determine how we are going to treat our patient that has now been diagnosed with cervical cancer. And we are here to support our patients, but we also want to encourage vaccination, screening, early detection,
Very
because
well.
it saves lives.
Thank you so much. I do have one last question, Ren,
Sure.
and this is, for I am maybe we may have a viewer at the moment who has cervical cancer undergoing treatment, or somebody who knows somebody who's going through, cervical cancer treatment or diagnosis. If you were to have like a bedside talk to this person that is tuned in, what words of advice, recommendations would you have for them, in terms of like looking after your well-being? I don't know. What would your bedside talk be for them?
Well, we do know that when women are going through difficult diagnoses, or anyone going through a difficult diagnosis, the first thing that they need is a listening ear. They need comfort, and they need reassurance. They also need to know that they have a voice in their own treatment and management course.
Very well.
So we want to work with our patients. So at the bedside, that's what I would be. I would be that listening ear. But at the same time, I want to give my patient all of their options in a way that they can understand. And if the patient says, "Doc, not today," I'm going to respect that as well, because it's a day-by-day process. Every day is not going to be the same. This patient may be going through the rigors of having hair loss, or having the nausea and the vomiting and the weight loss of going through the adjuvant treatment, such as chemotherapy. So it's all about understanding and encouragement. Also, I would advise that we involve the family once the patient allows it. I always encourage family support, community, because that is so important. And of course, if that patient has a basis of faith, like I do, I would also tap in, or encourage the patient to tap in to that source of faith, so that they are able to find strength as they navigate their diagnosis.
Very well. Thank you so much. Yeah.
And definitely, if somebody's listening right now, how would they, if they would like to get some medical advice or so forth, how would they be able to contact you, Dr. Rachel, if they would want to be able to just get a consultation of some kind?
Sure. You can reach me, or you can find me on Facebook, Instagram, and TikTok as your gentle gynecologist. You can also go to my website, www.yourgentlegynecologist.com, and go to the bottom of the page and drop me a message with your email address attached, and I will reply. You can also reach through WhatsApp at 1-868-494-6669. I am always open once I am available to answer questions within reason. Of course, we do know that the social media is not always the platform to deal with direct medical issues, but as long as I am able to assist and help, encourage, guide, that's what my mantra is. I want to be a doctor that is able to educate women and lift them by giving them the tools to manage their health.
And it's appreciated. We truly appreciate this conversation, and for our viewers that we're learning and understanding a little bit more, especially when it comes to the HPV and understanding, about vaccinations and the need for screening. I think it really comes at a timely manner when we're beginning the year off, and we should begin the year off in a healthy manner of screening and being mindful. So thank you so much for this conversation. We hope it's not the last.
Yeah, Dr. Rachel, gentle gynecologist fits you well. That's a great title for you.
Thank you.
Thank you, Dr. Rachel. We wish you a fantastic Monday. All the best to you today and what you have ahead for the week. We look forward to a future conversation with you.
Likewise to you guys. Thank you so much.
Bye-bye.
Bye, Belize.
Bye-bye.
Bye.